Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis. Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
The CEO does not want you to think about that he is working and that the corporation that pays him millions a year and probably gives him free health care, that in an instant he can get the help he needs for health care for him or his family, his children. They don't want you to know about market concentration. That's why Representative Ocasio-Cortez asked about it. He says, no, we don't do that. He said, we have a model that's best for basically the United States of America. What he's talking about when he says no about market concentration is that everything that he is the CEO over, they want it to be from the very beginning of them developing these drugs to manufacturing these drugs to being able to say, how can we get them to be distributed? So we got to sell them. We know that we need doctors to recommend them. And then we know that we need them in pharmacies. So let's have them go specifically to a CVS pharmacy. And then we'll tell people that's just how the market is. The market's saying that that's what it's worth. Market concentration means that they're controlling their portion of the market. So they're keeping you in their portion of the market so that you'll pay what they want you to pay. He's got his freaking butt over there without any problems in his life because he makes millions. And if you make $40,000 or $55,000 a year, you're screwed. Why? Because the health insurance is expensive and it doesn't include copays and everything else. Let me be transparent. I pay $600 a month just for freaking health care. That's not including me going to the doctor. That's not including if I have to pay for a prescription. That's not including any MRIs or anything. Isn't that disgusting? It's hard to do that. Okay, so now what about a family of 4? Now you're saying, well, I don't pay that much. Okay, so you don't. Be fortunate and grateful. But this is why Representative Ocasio-Cortez is saying you are interested in meeting that CEO and having market concentration for power to control it. But now to you little old CEO there. Why is it that you think that no one else has a mind of business? Why is it that you're so arrogant that you think, well, I'm the CEO. No one can really understand what I talk about when I say these things. There's not a person other than myself that would understand what a business model is. Here's the thing. You've taken for granted all of the people that have worked hard going through college and that have a lot of experience, but they weren't giving any opportunities that probably you have been given. But let's be honest. You're nothing more than a liar sitting on your fat ass there and your chair in your office, getting all of those raking in those millions, and you think that you are worth it and you're self-entitled. And I am sick and tired of Donald Trump supporting men like you that are pathetic. Because Donald Trump is not interested in helping people with health care when he says, I'm going to give you the money. How much? How many thousands per year, Donald Trump, are you giving the American people? Are you going to give us $20,000 a year for health care? Or is the rumor that what I heard of $1,500 a year? This is ridiculous, and everyone should be disgusted, whether you are independent, Democrat, or Republican, disgusted with this healthcare system in the United States of America right now.